Many dentists in the world are unaware of the innovation in dentistry. The innovation has happened in Japan. This innovation is in microscopic dentistry. The conventional technique proves to be good for endodontic treatment but very difficult for other dental treatment. The innovatio of the microscope was born in Japan 18 years ago. The innovation can be applied to all dental treatments. The penetration rate of Japanese microscopes in dentistry is the highest in the world. I believe this is the result of innovation I have developed that had a great impact. This book is a book that explains the innovation that happening in Japan. The name of the innovation is called the Three-Step Akiyama Method. The Three-Step Akiyama Method has changed the common sense of microscopic dentistry. The Three-Step Akiyama Method is a direct view technique using the microscope. The Three-Step Akiyama Method is a technique that can be used for all dental treatments. There are an infinite number of positioning, but there are only 6 basic positioning of the Three-Step Akiyama Method.
Good morning, everyone.
Good
Good morning. Why do you know my institute?
Through your YouTube channel.
Yeah. What name channel?
Katsuhiko
Akiyama channel?
Yes.
English channel?
Yeah, the English one.
Yeah. So maybe today I will record your training because you are first person to join my institute. So I told before, in the future, maybe some foreigner will come to my institute. So this is your first person. I thought, so these things is I already 20 years or 70 years before, I already told these things. But these things is historical things in Japanese dentistry. So my dream in the future, you will be the greatest doctor in Australia.
2. What is the Three-Step Akiyama Method? Characteristics of the Three-Step Akiyama Method. 1. The Three-Step Akiyama Method is a direct view technique using the microscope. 2. The Three-Step Akiyama Method is a technique that can be used for all dental treatments. 3. There are an infinite number of positioning, but there are only 6 basic positioning of the Three-Step Akiyama Method. 4. Three-Step Akiyama Method is completely different normal direct view under the microscope. 5. Three-Step Akiyama Method aims to improve the quality of treatment. 6. Three-Step Akiyama Method aims to shorten treatment time. 7. Three-Step Akiyama Method aims to perform dental treatment safely. 8. The Three-Step Akiyama Method is a technique that has great advantages in each of the lowest magnification, medium magnification, and high magnification. A technique like this has never existed before.
Positioning.
Positioning.
Yes.
Lower anterior lingual side.
Yes.
9 o'clock, 17 minutes.
Yes.
And chair is 50 degrees
Yes.
raised.
Yes.
One flexion.
Yes.
Yep.
One more.
And microscope body 15 degrees to the right.
Yes. Okay. P6 positioning.
P6 positioning. Upper arch, upper anteriors,
Yes.
palatal side.
Yes.
11 o'clock. 11 o'clock.
Yes.
Patient chair completely flat.
Yes.
And two. It's hard to say it in English.
Yeah. I understand. So yeah. So first time
Yeah.
I made strong to flexion. I forgot, but maybe I understand what you say.
Yeah.
And next, if you watch the left upper
left.
yes, upper left,
so
front side teeth, the palate side. So this time, please
time-
explain.
So you weaken the
Yes.
second flexion, or
Yes.
I guess the C shape,
Yes.
and then swing the microscope body to the left as far as possible.
Okay, good. Two-arm positioning. This time, so we will watch the microgram working. So this time is left side. So 10 o'clock positioning and 30 degrees raise the patient chair and one flexion. We say one. We say one. This is the two. Two flexion, two flexion, and one. And the turn 10 to 15. So if patient very difficult to open patient mouth, this time I tilted the microscope 10 degrees, but normally the 15 degrees is better.
少し左へ向いてください。道歩いてください。語学原子部新速、
はい、
9時17分、10度を起こす、1屈曲、左に15度振る、いいよ、ありがとうございます。
強度、10度から15度左に振る。対向障害があれば10度、なければ15度。
P1 position, lower left molar.
Yeah.
So at 10 o'clock,
10 o'clock, yeah.
Patient at 30 degrees, and so single flexion,
Yes.
And microscope body at 10 to 15 degrees. 10 degrees if patient has difficulty opening, and 15 degrees if no problems opening.
Okay. Yeah. That's good. So you have to use this part of mirror number 2. And this time you have to care about just only the foot. Sometimes the patient is very, very exhausting your treatment. So I put the mirror. This time I fix this finger and both sides, and I pull, but I pushed. You understand? Please. Yes.
P2
Yes,
positioning
P2 positioning.
for the lower left canine.
Yes.
So 9 o'clock in 17 minutes.
Yes.
So 50 degrees.
Yes.
And
Raised.
And single flexion. And the microscope body at 15 degrees to the right. 15 degrees to
Yes.
the right.
So, but the patient face tilted more left.
More left.
More left.
Oh,
And yes. You use the mirror, the upper lip, and this one. Positioning this time, so you never see this microscope. You memorize the positioning.
Yeah.
And 15, for example, 50 degrees raise, and the patient's face is like left, and finally you maybe will see this surgical microscope. This is a very, very effective to shorter the treatment time.
Yeah.
But if selected the positioning, so continuously watching the microscope, this it takes a long time. But finally you will.
Oh, okay.
Okay. And
Set up first and then look.
yes. So outside is almost setting up, and finally you watch.
Yeah.
So this is a sequence. You understand?
Yes.
Yeah.
13 to 2 simple direct viewing of a microscope. There is a quite difference between the simple direct viewing of a microscope and the three-step Akiyama method. Theoretically, it is about low stereoscopic vision and super stereoscopic vision. In a hands-on course sponsored by Academy of Surgical Microscopic Clinical Dentistry, participants were surprised to find that could not recognize the shape of tooth when carving an anterior tooth, canine tooth, with a direct bond, even though it was clearly visible under a microscope. They realized that the simple direct viewing of a microscope is inferior to the naked eye. What is important for stereoscopic viewing with a microscope is positioning that allows the shape to be recognized. By viewing from a position of 45 degree, 135 degree, to the three axes, it is possible to cover the difficulty of stereoscopic vision, which is a drawback of microscopes. The 45, 135 degree in the explanation of the three-dimensional technique Akiyama method is just basics, and the angle changes greatly the applied version. Simple direct viewing of a microscope treatment case. The slide is a model of the anterior tooth, canine tooth, immediately after being carved with a direct bond by an experienced dentist who is a student in a hand-on course sponsored by Academy of Surgical Microscopic Clinical Dentistry. It is well understood that simple direct viewing of a microscope is far inferior to treatment with the naked eye. Central ridge of left lower premolar tooth. Central ridge of left lower premolar tooth cannot be recognized by simple microscope direct viewing. I use the positioning using the three-step Akiyama method. You can clearly recognize the shape of tooth's central ridge. Central dimple of left lower premolar tooth. Central dimple of left lower premolar tooth cannot be recognized by simple microscope direct viewing. I use the positioning using the three-step Akiyama method. You can clearly recognize the shape of tooth's central dimple. 13 to 3. The biggest feature of the three-step Akiyama method, which is not simple direct viewing of a microscope. The biggest feature of the three-step Akiyama method is that it can recognize 3D objects. ZY. If we can see the X, Y, Z axis point from the same angle with the surgical microscope in direct view, we can better recognize the 3D view, more than the naked eye. It's clearly positioned at 45 degrees, 135 degrees, to the X, Y, and Z axes. Once such positioning is achieved, highly accurate stereoscopic viewing becomes possible. The three-dimensional technique Akiyama method is a technique that can see super stereoscopically. So, the three-step Akiyama method can perform all dental treatments. This surgery's technique is my original the patch technique. I wrote an article about the patch technique in Micro. Left slide is my article. 26 to 2 papilla reconstruction case. 25 years old female referral from periodontist case. The patient concern is the space between the maxillary central incisors, with upper left central incisor protruding due to periodontal disease. This tooth pocket is 8 mm. This time I will focus this place. Diagnosis: patient is severe periodontal disease. The space between the maxillary central incisors. The patient concern is the space between the maxillary central incisors, with upper left central incisor protruding due to periodontal disease. This tooth pocket is 7 mm. Nevin today, papillar construction very difficult and this case Case 2 treatment result pre-surgery 2 months after full mouth periodontal regeneration therapy, full mouth orthodontic treatment, orthodontic period of about 6.5 months, has been performed. Of course, full mouth correction is performed by the three-step Akiyama method. The crayon the right shows that the hard regenerated tissue has post-surgery 1 year's pre-surgery a pocket of 7 mm present in the left upper incisor mesial side, but 1 year later the periodontal pocket was 2 mm. Since the patient was an international student from overseas and returned after the treatment, it was not possible to follow up the patient. Post-surgery 1 year, radiographs show that hard tissue has regenerated to healthy condition. Post-surgery 1 year's pre-surgery patients are very satisfied with her beautiful smile after treatment. At the slide on the right, you can see that papilla between maxillary central incisor tooth is perfectly regenerated. This type of regenerative therapy, in which papillae are perfectly reconstructed to the long and thin contact point, may be the world's first case. This surgery's technique is my original patch technique. paradigm shift new microscope concept. The three-step Akiyama method is the world's first microscope direct viewing technique that offers great advantages at the lowest magnification. The advantage of the microscope in the conventional microscope benefit is that it can be high magnified. In other words, the advantage of microscope over the naked eye and loupe is that it can magnify greatly. This is the concept of microscopes around the world today. Japan is same, and microscopes are widely used with an old way of thinking. 18 years ago, when I developed and presented direct viewing of a microscope, microscopes were not very popular in Japan. They seem to have never imaged direct viewing, and was severely criticized when I mentioned direct viewing using the range of motion. My institute, named Minami Alps Training Institute for Microdentistry, students had been waiting for several years, so L didn't actively promote the three-step Akiyama method for a long time. As a result, a technique imitating the three-step Akiyama method has emerged and information is confusing in Japan. The percentage of dentists who stop using a microscope immediately after purchasing a microscope is very high. I think the cause is the result of believing the wrong information. There is no doubt that I am the original of the direct view of the microscope. There is evidence. From 2022, the academic society named Academy of Surgical Microscope Clinical Dentistry has started activities to solve the chaos in Japan. The three-step Akiyama method and the imitated direct view technique are completely different. Since June 2022, we are holding a hands-on course by Academy of Surgical Microscope Clinical Dentistry to people understand this. The three-step Akiyama method explained in this time is a technique that is completely different from direct viewing with a mirror or simple direct viewing, and its greatest feature is superstereoscopic vision. This hyperstereoscopic technique is called the three-dimensional technique Akiyama method, and is one of the three pillars of the three-step Akiyama method. I teach the control course, the three-step Akiyama method master course, at my institute. The three-dimensional technique Akiyama method is a technique that enhances 3D recognition of the treatment area compared to the naked eye or loupe by using wide field of view at the lowest magnification. The three-step Akiyama method is a technique with advanced rules based on three pillars: superstereoscopic vision, the three-dimensional technique Akiyama method, high-performance positioning, and ultra-efficient positioning. In particular, the feature is that there is always a reference point for the treatment area because we want to treat it super efficiently. The N types of positioning from P1 to P6 are the reference point positioning of each area in the patient teeth. In the case of posterior teeth, the buccal side and lingual, palatal side can be viewed from the same position just by changing the patient's face angle. If for the anterior teeth, the positioning, reference point, is such that the labial, lingual, and palatal sides anterior 6 teeth can be seen just by changing the patient's face angle. If the movable range of the microscope is small, or if it moves too much, the reproducibility becomes difficult. Currently, the Carl Zeiss EXTARO 300 straight neck microscope is the only microscope to which the three-step Akiyama method can be applied. To give an example of my influence in Japan, the Carl Zeiss EXTARO 300 is sold worldwide with a 120 degrees coupling, but most of ones sold in Japan are straight necks recommended by Akiyama. 120 degrees coupling are rarely seen or sold in Japan, also known as Akiyama coupling. Finally, I would like to share my beliefs. I will act for the patients of the world, is my conviction and my passion. I am looking forward to meeting you in Japan.
I had a really good time for these 6 days. Really thankful for Dr. Akiyama and the rest of the members of the association. I learned a lot about the microscope from using the traditional mirror techniques. Also learning about Dr. Akiyama's special mirror technique as well, and also learning about how to use the microscope with the three-step Akiyama method, and being able to use that so being able to see teeth in a 3D way with direct vision. That was really just an amazing experience. And then for the last 2 days, learning about some of Dr. Akiyama's cases and some of the cases from the other members. It was a really valuable experience. Just learning seeing how everyone is able to use the three-step Akiyama method to treat their patients. And also I'd like to thank Dr. Kakama and also Dr. Yamamoto as well for letting me visit their clinics and seeing how they use the microscope in daily practice. Not just the treatment itself, but also the way that they used to explain what the treatments and the diagnosis to the patients, and also their positioning and how they work with the rest of the staff. I think it was a really amazing experience, and I'm very, very thankful to Dr. Akiyama.
I'm looking forward to meet again. Thank you.
Good to see you again.
Thank you.
Thank you so much.
Thank you very much. Okay.